Now let's talk treatment. A helpful way to think about these three forms of creatine deficiency syndromes, CDS, is as one energy supply chain. The breakdown just happens at different points. When the problem is in production, it's usually easier to replace what's missing. When the problem is in transport, it's much harder. 1. AGAT/GATM deficiency. Can't make enough, but delivery still works. In AGAT/GATM deficiency, the first step of creatine production is impaired. The body can't make enough creatine, but the transport system is largely intact. So the approach is straightforward. Long-term creatine supplementation at medically supervised doses, not the casual gym supplement approach. This type often responds best to treatment. If supplementation starts in infancy, it may greatly reduce developmental impact, and in some cases help prevent obvious intellectual or motor delays. Even with a later diagnosis, many people see noticeable improvement in low muscle tone, weakness, and fatigue after a period of treatment. 2. GAMT deficiency, low creatine plus buildup of GAA. GAMT deficiency is more complicated because it's a double problem. Creatine is low, and the intermediate GAA builds up, which is thought to interfere with brain stability. Treatment is often a combination strategy. Replace creatine to address the deficiency as much as possible. Lower GAA, commonly by adding ornithine, along with a diet that restricts arginine and overall protein. Some clinicians also use sodium benzoate to help reduce GAA further. With consistent treatment, many patients may see improvement in seizures, behavioral symptoms, and movement issues. But if diagnosis happens very late, established language or cognitive impairment may be difficult to fully reverse. The key point is simple. The earlier it's found and treated, the better the outcome. Some children identified and treated in the newborn period can develop close to typically. 3. SLC6A8, creatine transporter deficiency, CRTR/CTD. It can be made, but it can't get in. With transporter deficiency, the main challenge is that even if you supplement creatine, it still may not enter brain cells because the transporter, the delivery worker, isn't functioning. Clinicians often try high-dose creatine, sometimes combined with creatine